Good evening and welcome to News 2 at 5. I'm Haley Wilgus. Bob Mueller has the evening off. Our first story tonight as we start with COVID-19 watch. The highly contagious Omicron variant takes the top spot as the prominent strain infecting people in Tennessee, and it's spreading at an alarming rate. News 2's Alex Dennis has more on what the state's top doctors say this new strain has the biggest concerns. Alex.
Well, Haley, it took about 3 months for the Delta variant to become the predominant variant nationally. It took Omicron about 3 weeks. And now in Tennessee, more than 80% of cases have been caused by this new strain. So the state's top doctor explaining that figure may actually be a little low as symptoms are different for Omicron, which may contribute to underreporting. A wave of new COVID infections now spreading through the state, due in part to the highly contagious Omicron variant.
It would be completely normal for you to think, wait just a minute, you just told me last week you had 4 cases in the state, and now you're telling me it's the predominant variant. That's how fast this thing is spreading.
State Health Commissioner Dr. Lisa Piercy explains she suspects case numbers may actually be much higher as at-home testing has become popular. Those results are rarely reported to the health department. Another factor, early indicators show symptoms caused by the Omicron variant don't mimic what we've become accustomed to expect.
If you're thinking, oh, this is just a cold, if this were COVID, I would not be able to smell or taste. That very well may not be true with Omicron. That should not be your litmus test of whether or not you have COVID.
The state also reporting vaccinated people can contract the new virus strain.
With Omicron, that breakthrough cases are common, but we do know that vaccination, just even the primary series, does appear to protect you against those severe outcomes like hospitalization and death.
What's still unclear is how the Omicron variant will affect unvaccinated individuals.
Sometimes it'll take 1 to 2 weeks for hospitalizations to start going up after cases go up. It just hasn't been enough time yet.
Another concern facing the health department.
We are in extremely scarce supply of monoclonal antibody.
And new data suggests that most of the antibody treatments currently on the market are powerless against Omicron.
There's now only one monoclonal antibody product that works against Omicron, and that's the one called sotrovimab.
The state received 810 doses earlier this week, but doesn't anticipate another shipment until the week of January 3rd at the earliest. There is some good news to give you tonight when it comes to protecting those who are autoimmune compromised. The FDA granted emergency use authorization for Evusheld. It's an injection made by AstraZeneca. It is the first antibody cocktail for COVID-19 used for pre-exposure to the virus. Dr. Piercy explains one shot could give protection for 6 months. So if you are at high risk, she urges you to contact your doctor to see if this treatment could be right for you. Haley.